Hello, everyone. My name is Bryan Boise Cortez, a law librarian at the Office of the Government Corporate Council here in the Philippines, and the current secretary of the Special Libraries Association Asian Community. I will be your moderator today. Last time, our partner institution, Association of Special Libraries of the Philippines, co-lead our session. We were joined by the Director of Department of Science and Technology, Science and Technology Information Institute, or DOST STII here in the Philippines, Director Richard P. Burgos. He discussed about communicating trustworthy science and technology information in the digital world. Now, to formally begin our program, may I call on the President of Special Library Association Asian Community, Mr. Joseph M. Yap, for his welcome remarks.
Thank you, Brian. I would like to welcome all of you to this second webinar series. This webinar series was conceived to advance the role of librarians and libraries in situations where transparency and accountability of truthful information are questionable. Access to content and media generated by information producers can be found in different unverified sources. We saw a spike of unreliable sources during the pandemic, thus, the need to have a trustworthy exchange of communication and information in medical and health sciences. This is the second of a four-part series that focuses on the value and role of librarians in today's online information society. Today's webinar will focus on medical and health sciences as our target domain. With the help of our experts, our aims are to discuss and learn medical and health library initiatives that reveal the truthfulness of information, highlight the critical role of medical and health libraries in identifying the integrity of information, and encourage citizens to view libraries and librarians as partners in providing reliable scholarly and scientific content. The succeeding webinars will focus on another domain that I invite you to complete all sessions and be fully engaged by posting questions in the comments box. Although specific domains are represented, the discussions, experiences, and strategies may expand and can be adopted by all types of libraries. We will ask our expert resource persons to answer your questions on this channel. I wish everyone to always have a critical and unbiased mindset to all sources and types of information, media, and content that we face every day, regardless of authority or public opinion. We hope that we captured your attention and you finish all four webinars. So let's start learning. Once again, my name is Joseph Yap. Happy viewing.
Okay, thank you very much, Sir Joseph. This session will not be possible without our partner association, Japan Special Libraries Association. Thank you very much for accommodating our request to be our partner for our session today. We will be having 3 presentations today. Let me call on our first presenter, and also she will explain the overall theme today. So our topic number 1 is fighting fake news and infodemic, action of medical and public libraries in Japan. Our first speaker is a librarian of Chibaken Saiseikai Narashino Hospital, social welfare organization, Saiseikai Imperial Gift Foundation Incorporated, and JMLA Health Science Information Professional, accredited by Japan Medical Library Association. She finished her Master of Library and Information Science at the Keio University and Master of Informatics at the Open University of Japan School of Graduate Studies. Her research interests are medical library, hospital librarians, media literacy, health communication, and library and information science, to name a few. Recently, she received the Kobayashi Prize, Graduate School of Literature, Keio University. She is a member of different professional associations such as Information Media Society, Japanese Association of Health Communication, and Japan Library Associations. Let's all welcome our first speaker, Ms. Masae Sato.
Thank you very much, Joseph, Bryan. Thank you for wonderful opportunity. I'm Masae Sato. I'm my first speaker. Thank you. So it's a great pleasure for me to be speaking to you today. As you can see on the screen, today's theme is current effort to combat fake news, health and medicine with special libraries, librarians, and experts. As trained professionals who evaluate information and judge its validity, we librarians are ready to join the fight against fake news. With the assistance of physicians, journalists, and another expert, we will explore what role special libraries can and should play in the fight against fake news in the medical and health fields. So this seminar is divided into 3 parts. Each will last about 15 minutes. The first part will be led by me, Sato. I will introduce how medical and public libraries in Japan are fighting fake news and infodemics. The second part will be by Ms. Kitazawa, a visiting professor and journalist. She will introduce how to systematically read research papers in the health and medical fields. And in the third part, Dr. Watanabe, clinical professor, will talk about their activities to improve the quality of health news through reporting and communication in Japan. Please note that the second and third part are pre-recorded. Before we begin topic 1, I would like to explain a little about Moderator Japan. Today's 3 speakers are members of the Executive Committee of Moderator Japan. Moderator Japan is a non-profit organization dedicated to verifying and disseminating reliable medical and health information. Then, we are going to start topic 1. Again, my name is Masae Sato, Hospital Medical Librarian in Japan. This is my profile. In my presentation, I'll focus on 4 major issues as shown. Number 1, fake news and infodemic in healthcare. Number 2, 6 resources for evidence-based practice, the 6S pyramid. Number 3, a medical librarian's role in Japan. And number 4, cooperation between medical and public libraries in Japan. Now, I'd like to focus on fake news. There are 2 types of fake news. Misinformation means inaccurate, and disinformation is false information which is intended to mislead. This study showed that fake news spread further, faster, deeper, and wider than true information. To prevent such pandemic, we can take 4 actions: listening, promoting, building, and engaging. Our After COVID-19 pandemic, World Health Organization (WHO) announces Infodemic, Information Pandemic Management. We can subscribe to the Infodemic Management News Flash to receive latest bi-weekly update from WHO team. This infographic, How to Spot Fake News COVID-19 edition, is available in multiple languages. With fighting misinformation around COVID-19, a key part of the overall response to the pandemic, librarians have the reputation and the skills to make an important contribution. So, the Health Science Library of McMaster University advocates a 6S pyramid. This represents ABM. In evidence-based medicine, a higher up the pyramid, the greater the ability of the evidence to guide clinical behavior. The lower down the pyramid, the more specific the topic becomes. For example, summaries are regularly updated clinical guidelines or textbooks that integrate evidence-based information about specific clinical problems. So, to discuss the medical librarian role in Japan, I'd like to focus on the libraries belonging to the Saiseikai Narashino Hospital in Chiba, where I'm working. There are two types of library in the hospital: medical library and patient library. Medical library gives clinical information to healthcare staff in the hospital in this area. Patient library in the hospital gives medical and health information to patients, their families, and health consumers. Turning our attention now to Web-based collaborative book selection system project. Web-based collaborative book selection system project Health and medicine for patient. This collaboration with medical libraries, public libraries, and researchers for collection development in health and medicine. So this is the Moriyama Library and Shidami Library in Nagoya. They collaborate with medical librarians, researchers, and local communities. Health and information literacy lectures are very popular because of the longevity of the Japanese people. For example, Oncology lecture with Patients Association of Local Committee and Health and Information Literacy lecture with medical librarians and researchers. So, the Shin Narashino Public Library in Chiba works in cooperation with my hospital medical library. Medical librarians suggest appropriate health and medicine related books for public library patrons and provide them with tools and leaflets to search for them. So, I lectures about health and information literacy, terms fighting fake news. This speaker it's me. So, librarians can provide strategies for evaluating reliable and accurate information while demonstrating knowledge of how to determine and authenticity of information. In doing so, we can encourage people to see librarians as potent partners in providing reliable scholarly and scientific content. So we hope you find our talk useful. Thank you very much.
Thank you very much, Ms. Masae Sato. Japan's action to fight fake news and infodemic through medical and public libraries is very effective that can be adapted to different countries. We should work hand in hand because fighting fake news and infodemic demands a united effort from all stakeholders. Through enhanced media literacy, responsible technology, and collaborative action, we can navigate the digital landscape more safely and protect the integrity of information in an increasingly interconnected world. Thank you once again, Ms. Masae Sato. And now to proceed to our next topic. Thank you very much.
Thank you very much.
We will now proceed to our next. Thank you very much.
Thank you.
Next topic: how to read a research paper in health medicine.
Yeah.
So our next speaker. She is a visiting professor of
Ms. Kyoko Kitazawa for topic 2.
She is a visiting professor of Kyoto. Yes.
And Dr. Kiyotaka Watanabe for topic 3. Thank you very much.
Yes. Thank you. So once again, our next speaker is a visiting professor of Kyoto Pharmaceutical University and journalist. She has a Master of Science degree from London School of Hygiene and Tropical Medicine, London, United Kingdom. She authored books about health such as Society, Medicine and Pharmacy, Healthcare Information Guide for Patients, and Introduction of Drugs and Chicken for Patients. Let's all welcome our second speaker, Ms. Kyoko Kitazawa.
Sorry, Sato-san. Can you stop? Okay.
Hello, everyone. My name is Kyoko Kitazawa. I am a healthcare journalist. Today, I would like to talk about what it means for us to read research papers in health and medicine and what we should check when reading them. We are exposed to a variety of information on health and medicine, and we use this information to make decisions and act. For example, when we read a magazine article saying that jogging is a healthy way to lose weight, we may try it. When we suspect that a sudden headache might be a side effect of a medication, we may consult our pharmacist. There are 3 C's in the flow of health information. First, researchers and health professionals publish the research papers and clinical practice guidelines and so on. This is creating. In Japanese, we say tsukuru. Next, journalists write articles about the research result, and the researchers themselves give lectures and other talks to spread the information. This is conveying. In Japanese, tsudaeru. Today, with the spread of social media, anyone can convey the information. Consuming, in Japanese, tsukau, is the act of making decisions and action based on the information conveyed. Unfortunately, however, it cannot be said that information is not twisted or misinterpreted during the flow. In order to consume information correctly, it is beneficial for us to go back to the source of the information, the creation, or research papers. Reading research papers helps us to acquire real knowledge. Today, the concept of evidence-based medicine is very important in clinical medicine, as shown in the slide. Integrating the elements of clinical state and circumstances, patients' preferences and actions, and research evidence, we will make decisions by superimposing the clinical expertise. Research evidence at the bottom right refers to evidence obtained from clinical research, which we can learn about it reading research papers. EBM is a 5-step process as shown in the slide. Step 1 through 4 are done in sequence, and Step 5 evaluates Step 1 through 4. Step 1. Converting the need for information, that is, organizing the question to identify a key problem. Step 2. Tracking down the best evidence with which to answer that question. For example, searching for the evidence with databases. Step 3. Critically appraising that evidence for its validity, closeness to the truth, impact, size of the effect, and applicability, usefulness in our clinical practice. Step 4. Integrating the critical appraisal with our clinical expertise and with our patients' unique biology, values, and circumstances. Step 5. Evaluating our effectiveness and efficiency in executing steps 1 to 4. I will now explain each of these steps. In step 1, we organize the question we want to know the answer in the form of a PICO. In this case, the question leads to a decision-making or an action, not just getting knowledge. In other words, what should we do? P stands for patient or population. In the case that you are the object, then P is yourself. I or E stands for intervention or exposure. C stands for comparison or control, and O stands for outcome. For example, a healthy 10-year-old child in my country received the COVID-19 vaccine. Does it reduce the risk of getting COVID-19 compared to not receiving the vaccine? In this case, P is a healthy 10-year-old child in my country. I is receiving a COVID-19 vaccine. C is not receiving a COVID-19 vaccine, and O is getting COVID-19. Step 2 is to search for the best research evidence that matches your question. It is common to search for PubMed, Google Scholar, Cochrane Library, and others. The number of research papers in the health and medical field is rapidly increasing these days. The pandemic of COVID-19 has had a significant impact on scientists' research activities. Scientists share their findings faster than ever through preprints besides peer-reviewed papers. According to the Dimensions database, in 2020, about 4% of research papers published worldwide were related to the new coronavirus or COVID-19. The number of research papers in PubMed alone is estimated to be about 80,000. The cooperation of librarians, who are experts in information, is indispensable to search for the evidence from the vast number of research papers. In Step 3, the evidence retrieved in Step 2 needs to be critically appraised. In this step, we mainly examine the internal validity of the clinical research. Internal validity means that the clinical research has been conducted properly, in a manner that is as unbiased as possible and that is reliable. Each research design has its own checkpoints. For example, In a randomized controlled trial, recruited participants are randomly allocated into 2 or more groups. When there are 2 arms, one for the intervention and another for the control, and each group performs different treatments and compares the result. At each stage of the process of the RCT, there are some points that need to be checked. For the participants, is the sample size appropriately calculated? For allocation, are participants randomly allocated to the intervention or control group, and so on, as shown in the slide. Let me introduce the CASP, Critical Appraisal Skills Program. CASP was developed in the UK in 1993 to teach critical appraisal of research papers. Critical appraisal skills enable you to systematically assess the trustworthiness, relevance, and the results of published papers. The CASP has over 28 years of significant and unrivaled expertise in the delivery of training to healthcare professionals and lay people as well. By using its cascade approach, CASP now has branches all over the world. The first CASP International Training Week was held in London in July 1999. The meeting was attended by over 20 delegates from 11 countries. I was one of the participants in the first CASP International Workshop. Since then, CASP-style workshops have been held in Japan for a variety of people, including healthcare professionals, patient groups, students, and librarians. Please refer to the CASP UK website for a list of checkpoints for each research design. Step 4 is the most important step. That is the step of critically reviewing the evidence presented in the paper and considering whether it can be applied broadly and generally. This is called external validity. Even if the paper has high internal validity, you may not want to apply it to yourself if your condition is very different from that of the participants in the paper. More precisely, questions shown in the slide are considered. Are the study participants similar to the people in your population? Are the outcomes important to your population? Are there any other outcomes you would have wanted information? Are there any limitations of the study that would affect your decision? And would the experimental intervention provide greater value to the people in your care than any of the existing interventions? In the final step, step 5, you will review and evaluate the previous steps 1 through 4. Often, the next question arises. Then, this will lead to the next step 1. The EBM approach is to repeat step 1 through step 5 in this manner. The clinical research paper is not difficult once you get the hang of the research design and critical appraisal. Librarians who convey health information are also encouraged to become familiar with research papers. Thank you for your attention.
Okay. Thank you very much, Ms. Kyoko Kitazawa, for sharing a clear instructions and strategies in reading research paper in health and medicine. It's really an interesting discussion. I'm sure medical librarians who are listening now got many lessons from your discussions that they can apply in their everyday work. Okay, for our third speaker, we will discuss about improving quality of health news, reporting, and communication in Japan. He is a clinical professor of medical oncology, Department of Medicine, School of Medicine, Teikyo University, Secretary General of the Media Doctor Japan, visiting professor of Open University Japan, Saitama Medical University, and Congress Chair of the 9th Annual Meeting of the Japanese Association of Supportive Care in Cancer. He is also a recipient of a Mentor Award at the Medical Industry Innovators School by the Medical Industry Innovation Organization. Let us welcome Dr. Kiyotaka Watanabe.
Hello, I'm Dr. Watanabe from Teikyo University, Tokyo, Japan. I'm a director of Media Doctor Japan. And today I'd like to talk about improving quality of health news reporting and communication in Japan for SLA Asian chapter. I'm very happy to talk about this topic today. So Media Doctor was launched in 2004 with the aim of providing an objective analysis of strengths and weakness of health news reporting in the Australian media. It also seeks to increase the completeness and health stories and subsequently health literacy among journalists and media consumers. News or reporting, including health and medical issue, the reporting is when the reporting is accurate or well balanced, covers various aspects, the consumers, that is patients or public, can fit for health and news reporting, and they use these news reporting for decision making. But if the news was inaccurate or unbalanced or covered insufficiently, the consumers have excessive expectations, future demand, or unfavorable for decision making. So if the good news can consumers can easy to understand and to facts and limitation of the about the health news. And if the news was inaccurate, consumers can learn nothing from the reporting. So the media doctor criteria is shown below. It includes novelty, availability or access, alternative, disease monitoring, or quality of evidence, benefits, harm, cost mentioned, or news resource, and press release. It has 10 criteria in Media Doctor Australia. We used about almost the same criteria in Japan since 2007. We experience of using Media Doctor criteria in 2006 and evaluated 7 news reporting in Japanese news media. We know that bad for benefits and disease mongering, and good for novelty, good criteria, and these criteria is good and fit for evaluation in Japanese news reporting. So we studied to discuss health news reporting in Japan using these criteria. Agenda of our activities is shown. It includes medical error, accident, or pandemic. It also includes cancer screening, diagnosis, and treatment, or very novel technology, including regenerative medicine, including iPS, stem cells, emergency medicine, mental health, geriatric medicine, diagnostics, complementary alternative medicine, and clinical trials. We also have discussion on public health or risk communication, including disaster. In Japan, we have very much complicated on earthquakes, tsunamis, nuclear power plant, or we also discuss on screening or vaccine. The characteristics of medical news reporting in Japan is discusses on medical science, including mechanisms, that is basic science or biology, or policy on healthcare, that is, for example, reimbursement, error reporting system, health insurance, emergency or lawsuit on medical error side effects. And it also includes issues on advertisements, for example, supplements, private insurance, new procedures. But however, very few reports on original medical or journal article. We discuss on Japanese medical article on Media Doctor Japan. So our strength is longevity of activity, that is 16 years, over 90 times on the meeting. And we have Japanese version of evaluation criteria from our discussion. And we collaborate with medical professionals, journalists, and public, and provides chance of reporting and reading skill for students, librarians, coordinators, medical professionals, etc., etc. And these are Media Doctor activity all over the world. Unfortunately, Media Doctor Australia was ceased in 2012, and in Canada, 2011, the activity was closed, and even in US, 2018, the activity was shut down, and in Media Doctor Germany and Japan are still active. Yeah, and we can discuss on medical news reporting in Japan and also Asia Pacific region. So finally, this is the final slide of my presentation. The next steps of Media Doctor Japan is we like to have forum or seminar on evidence-based medicine or journal database, and we like to discuss locally, not globally, as well as globally, local seminar and education program for students, librarians, or medical professionals or public. So it includes activities for public to validate our criteria of Media Doctor criteria, and we like to have evaluation team, and the result of the evaluation we like to open via website. And we like to collaborate worldwide with Asia Pacific, and we like to act globally and to communicate with our colleagues worldwide. Thank you for your attention.
Okay, thank you very much, Dr. Kiyotaka Watanabe, for your presentation about improving quality of health news. Thank you for sharing your experiences and help us understand that health news reporting and communication is of utmost importance to ensure the public receives accurate and reliable information, which is very important, especially in time of pandemic that we are experiencing since 2020. So now thank you very much to all our speakers, Ms. Masae Sato, Ms. Kyoko Kitazawa, and Dr. Kiyotaka Watanabe for your time and invaluable contribution in making this session successful. I hope we can meet each other soon in person. And to formally conclude our session, may I call on Ms. Yuko Sawada, Director in charge of Information Dissemination Team, Library and Information Division, Academic Information Center, Institute of Developing Economies. Ms. Yuko Sawada for her closing remarks.
Thank Ms. Masae first. Sato-san, I think.
Yes.
Oh, I'm sorry.
Sorry.
To wrap up.
Thank you.
Okay, sorry.
Thank you very much. Thank you very much.
Correct.
Thank you, Joseph.
Yeah.
Thank you, Brian. Thank you. If you have understand, please visit to the Media Doctor website. We look forward to hearing from you about international collaboration. Thank you attention, and that's thank you for very much wonderful opportunity. Thank you very much. Thank you.
Okay, thank you very much, Miss Masae Sato. I'm sorry for the error. And now, to formally conclude our session, may I call on Ms. Yuko Sawada, Director in charge of Information Dissemination Team, Library and Information Division, Academic Information Center, Institute of Developing Economies, for her closing remarks.
Thank you very much. I am Yuko Sawada, a member of the committee and the country representative of SLA Asian chapter. We hope you enjoy participating in this event as much as we enjoyed planning it. On behalf of the Japan Special Library Association, JSLA, I'd like to say a few words. Today's theme is current efforts to combat fake news in health and medicine, working together with special libraries, librarians, and experts. We librarians, along with other professionals, have been exploring how we can play a role in the fight against fake news. In topic 1, Ms. Sato introduced WHO's Infodemic Management News Flash, IFRA's infographic, and McMaster University's 6S Pyramid for an evidence-based medicine, while discussing the collaboration between medical and public libraries in Japan and reporting on countermeasures against fake news and infodemics. In topic 2, Ms. Kitazawa explained how to systematically read research papers in health and medicine, following 5 steps: converting the need for information, tracking the evidence, critically appraising that evidence, integrating the appraiser with expertise, and evaluating these steps. In topic 3, Dr. Watanabe introduced the activities of Media Doctor Japan, which analyzes the health news using the own rating criteria to improve the quality of information and the health literacy of journalists and media consumers. We hope that these efforts of Japan will inspire your work as well. On a personal note, I'd like to thank the wonderful speakers, the audience, and the board of members of Asian chapter for providing such an interesting and meaningful session. Finally, I'd like to conclude my remarks by wishing you all the best in your success and prosperity. Thank you very much.
Okay, thank you very much, Ms. Yuko Sawada. And that ends our session. Thank you very much for listening, and I hope you share this session to your fellow librarians. Our next session will be about empowering farmers through Indonesia Agricultural Ministry Library Services with our partner association, Asosiasi Perpustakaan Perguruan Tinggi Islam Indonesia. Once again, thank you very much. This has been your moderator, Bryan Boise Cortez, saying goodbye and keep safe and be healthy.